confirmed case. And the number of existing confirmed cases is declining, and the number of patients discharged from hospitals is rising. So we are looking up. And that is a solid proof about the precise measures taken in Beijing to control the epidemic. It's totally under our control. And we must consolidate our confidence to win this battle that belongs to the whole public. But confidence doesn't equalize dropping our vigilance, and zero newly added case doesn't equalize with zero risk. We still have to stay alert and continue our useful efforts to further cement our achievements. With more scientific, targeted measures in place, we will work on sorts of prevention and control measures, and we will accelerate the resumption of work and production orderly. For one thing, we work on epidemic control and prevention. For another, we are now stepping up medical services. Medical treatment is given the top priority. Beijing has gathered a strong team of experts with rescue members and resources already for the patients. And now the patients are being treated in Ditan Hospital. Yesterday, on July the 8th, we have cured 32 cases in total. Ever since the outbreak of the epidemic in Beijing, the number of patients discharged from hospitals per day stood at the largest yesterday, and we believe that that number will continue to rise up in the future. We must further implement the principles about distinguishing the different cases, caring for every patient, and continue to improve the curing rate and the discharge rate. Simultaneously, as to rescuing the patients, we must coordinate the medical services offered to those patients and the non-coronavirus patients in order to resume the general order in the hospital with enough treatment resources to the other patients' categories. We must mobilize the medical resources with the categorized medical services to different types of patients to guarantee the safety of all patients in hospitals. For example, for the intermediate level or high-risk districts, we must solve the problem of difficult hospitalization of those patients. As to the resumption of work and production, we must accelerate the pace. In the prevention and control situation, which has become a new normal, we will intensify the resumption of orderly work and production. We want to maintain the steady progress of our lives and our workforce. We will shoulder our due responsibilities, particularly in the catering business, restaurants, the food production enterprises, and other key businesses. We will step up our quarantine and examination measures. With any problem discovered, we will urge them to check and correct. In stability, we will seek progress. We will march towards our set target. For example, according to the requirement of high-level opening up, we will try to create a more equal, fair, transparent, and foreseeable business environment for the enterprises. And under the current policies, we will help enterprises to resume their production and operation. We will stabilize employment to improve people's livelihood and to minimize the impact of this coronavirus. As to disinfection, body temperature checks, social distancing, and other regular control measures, and individual protection measures, we will highlight those principles and healthy lifestyles among the general public. Today, we have invited experts from Beijing CDC, the Capital Medical University Xuanwu Hospital, and Guang'anmen Hospital to take the questions and to brief us about the newest information of the epidemic. Now, I would love to present to you the experts. They are from Beijing CDC, Deputy Director Liu Xiaofeng, From Guang'anmen Hospital, Party Secretary Madame Wang Xiaoping. And from the expert panel of National Coronavirus Rescue and the director of the Heavy Disease Division of Xuanwu Hospital, Jiangli. Now let's firstly give the microphone to Mr. Liu Xiaofeng to brief us about the epidemic situation in Beijing. Dear media friends, good afternoon. By the end of July the 8th, there was 0 newly added confirmed or suspect case in Beijing. For 3 days in a row, we have maintained such progress. Now, as to the 2 cases concerning the collective infection, case 1, Lu, a procurement personnel who frequently visits Xinfadi, and he had symptoms in June, and on June the 13th, he had quarantined himself according to the employer's requirement, and the body temperature was 37.3. So he went to Wentogou Hospital for nucleic acid testing, but the result was positive. And then he was quarantined. And the employer had another round of nucleic acid testing and discovered that his roommate, Mr. Li, also had positive result. So they were transferred to the hospitals for further quarantine. Another case said that he had never been to Beijing, and he refused the argument that he has been to Xinfadi wholesale market. And he said that he has always worn the facial masks when he was out. And he has been residing together with case 1. And he was moving to another dormitory later on, and after getting infected in Xinfadi wholesale market of case 1, the Mr. Li was infected by his roommate. From June the 17th to 22nd, in Huangcun Township of Daxing District, 13 employees and 3 family members of those employees were confirmed as the positive cases. And the first case was a female, 49 years old, a worker in the factory, and on the 17th, she went to the Xinfadi wholesale market for procurement, and then he had symptoms like cough, and she went to Daxing People's Hospital for more examination and was confirmed as a positive case on the 17th. Case 2 was a female, 39-year-old, also a worker in the same factory, procured in Xinfadi wholesale market and had symptoms on the 14th and had positive result of nucleic acid testing and was confirmed on the 15th. Among the 13 workers, only those above mentioned 2 cases have visited Xinfadi wholesale market. For the other positive cases, they were the close contacts of those 2 cases. And according to our observation, in the factory there was no window for ventilation, and there was a high density of population. Different production lines share similar changing lock rooms or exits and entrance, and in the public spaces, some employees didn't wear social masks. So the factory was locked down on the 15th, and among the 13 patients, 2 patients further infected their family members. So that is about the collective infection. So from those 2 scenarios, we are alert that enhancing our awareness about prevention and control and do good protective jobs on ourselves and shoulder our individual responsibility are the key measures to prevent the further spreading of the coronavirus. The general public will have to abide by the guideline in Beijing. For example, wear facial masks. With professional facial masks, the professionals must have a social distance and wear facial masks when they're on posts. As to the patients with respiratory system injuries, they must avoid going to the public spaces. But if necessary, and they have to go to the public spaces, they must wear facial masks. For the elderly people and other vulnerable groups, we have to wear the medical purpose facial masks, particularly the medics. If the patients go to the hospitals, they also have to wear the medical purpose facial masks, including their family members. And as to the general public, we must avoid going to the public spaces like the parks with high density of population. And if you have to take public transportation, you must wear facial masks as well. Secondly, keep a social distance. The conditions like catering business, the barber shops, and other shopping malls, we must properly manage the visiting time to avoid a gathering of population. And in spaces like we are lying in a queue to take the food, there must be the alert lines like 1 meter distance on the floors. And as to the entertainment places, we must have appointment and avoid the rush hours. Third, sanitation. The general public must have a good habit of washing their hands after going to the toilet or before taking food. If the suspicion is already there about those disease infection, then we must disinfect ourselves and do not touch our nose or our mouth. And when we are coughing, we cannot touch our mouth or nose with our hand if you haven't washed your hands. Fourthly, if you have to eat out, you must find qualified restaurants. And for the materials you bought in your homes, you also have to buy and procure from those shops with certificates. And for those pork or beef or lambs and other aquatic food, you must boil them to the full. And as to the knives handling those meats and the other kitchen utilities, you must wash them cleanly. And fifthly, for daily disinfection and cleaning, every day we must have 2 to 3 times of ventilation, with each ventilation lasting for at least 30 minutes. We must also have to clean and tidy our rooms regularly. For the air conditioning system, we must clean those filters in the air conditioners. And every day we must take out our garbages and do not pile them up in the public spaces like the staircases. Instead, we must throw them in the specific garbage cans in the community. So we must take practical measures to honor our commitments to the epidemic control measures and to consolidate our results achieved. Thank you, Mr. Liu Xiaofeng, for your briefing. Next, let's give the microphone to our expert from Xuanwu Hospital, Jiang Li, to give us the updates about the management of asymptomatic carriers. Good afternoon, ladies and gentlemen. According to the documents launched on April the 6th, asymptomatic carriers are those people with no symptoms like cough or throat pains or the other clinical symptoms. The nucleic acid testing of those patients are still positive. And there may not be such virus-based disease checked, so there are possibilities of infection in those patients. As to asymptomatic carriers, there are 2 categories. One is about the asymptomatic carriers in their incubation period. They may have cough or fever. Their CT scanning may also have a change in their lungs, so they will be confirmed as a positive case. So in the Xinfadi incident, in the beginning we had 52 asymptomatic carriers and 21 were then confirmed as positive cases. And the others had symptoms after being taken into hospitals. So those patients are still in their incubation period. Even with no symptoms after nucleic acid testing, those patients will be observed collectively in the hospitals, and during the observation time, the doctors will observe whether there will be occurrence of such clinical symptoms. If they do, or if there are some lung changes in the imaging department, there will be further medical treatment interventions. So for those asymptomatic carriers, if they have no other infection symptoms before they turn to be negative in nucleic acid testing, for those people with no symptoms in their incubation period, they might later on be confirmed as positive cases with the nucleic acid testing. So we need further observation of those asymptomatic carriers to avoid any further infection. And after 14 days of medical observation, and when their nucleic acid testing turns out to be negative, their observation will be suspended. But if the result of the nucleic acid testing is positive, we will continue the observation. Thank you, Madam Jiang Li, from the Coronavirus Treatment and Rescue Expert Panel. And next, let's invite the Party Secretary from Guang'anmen Hospital, Madam Wang Xiaoping, to give us an introduction about the management measures in Guang'anmen Hospital, about medical services and the epidemic control. Dear media friends, good afternoon. Now, on behalf of Guang'anmen Hospital, to brief you about our epidemic control situation. So since the outbreak of the epidemic, Guang'anmen Hospital has always borne in mind about caring for the general public and to safeguard the achievements made in Beijing's epidemic control. We have stringently abided by the requirements of the leading group in Beijing epidemic control and prevention, and under the leadership of the Chinese Academy of Traditional Chinese Medicine, we have been working hard, shoulder by shoulder, to carry on those good practices, and we have been readjusting our daily works in different posts in order to maximize the resources diverted to those patients. We guarantee zero infection among the medics, and all the patients referred to our hospital will not be left behind. And the party secretary of our hospital has shouldered our responsibilities. For example, we guide the whole hospital by mobilizing the different divisions and individuals to stay on their posts and shoulder their responsibilities with our overall system. Even the logistics and the other departments have been coordinating closely. We also have theme-based regular conferences and daily reports and a listing system in place. So prevention and control, scientific and research, logistics preparation, and research support are combined together. So since the outbreak of the epidemic, we have convened 50 thematic conferences. We have improved our working procedure, including over 300 items. And we have different rehearsals for 100 times. So prevention and control and personnel management have been covered with nothing missed in our management system. We also have 5 stringent measures to control the infection in the wards and in the entrance and exits, and even in the parking lots. We have diverted the density of population. And we also have a system in place to separate the treatment of different categories of patients. So screening, review have been very strictly implemented in our hospital. And we also have counseling before treatment, which is multidisciplinary. We have built our team of experts to enhance our training and the review of some key divisions and some key places and key personnel, so as to form a closed loop of management and to reduce the cross-infection. Secondly, combining traditional Chinese medicine and Western medicine. According to the requirements of the National Health Commission, Tong Xiaolin Academician and Qi Weishen, as members of the national team, have been working in the front line in Wuhan for rescue and treatment, particularly providing their expertise in traditional Chinese medicine. For respiratory division and psychology division, they have also dispatched 15 doctors to work in Wuhan, particularly working in posts saving those dangerous cases and heavy diseases with very good effects. The experts also have been to Fangcang Hospital and the neighboring communities with their traditional Chinese medicine solutions, contributing to the battle in Wuhan. They also play a big role in exerting influence of traditional Chinese medicine. Our hospital has the co-counseling system in place, combining experts from different disciplinaries. We have covered different divisions like imaging department, respiratory department, and so on. With the team of experts, we have dispatched those experts for 32 times of counseling. And for 25 entities in the city, we have in total offered the counseling and guidance of those imaging results. So TCM has played its key role. Thirdly, to guarantee the rescue of those dangerous cases, under the principle of life and safety coming first, for the chest pains and operations, we have a green channel for those patients. And for the dangerous cases and patients under severe situations, we also have a priority given to them. And patients with tumor in their brains, they are also belonging to this category. We have set up a specific time period and specific section to those vulnerable groups. For example, the groups with no nucleic acid result but with severe symptoms, we may offer the hemophilia dialysis. And for 5 days, we had built a flexible nucleic acid testing laboratory. And we also have another laboratory for the genetic clinical trials. In Xicheng District and Daxing District, we have handled about 160,000 nucleic acid tests. We have kicked off national-level public health projects to handle the projects like the chest pain laboratory, and in total we have built 2,500 square meters of emergency spaces, and to boost our capacity of responding to those public health hazards. We have handled 576 cases of severe tumors, and we have handled the hemophilia dialysis of over 10,000 cases. Fourthly, prevention and control and internet-based technologies have been combined to improve our capacity of medical services. To accelerate informatization establishment, we have been optimizing appointment, drug taking, examination services so that information will be smooth and the patients will not gather together. Online and offline technologies are combined together in order to build smart and intelligent hospitals as one of the first TCM hospitals with online medical services. In May the 26th, we have another certificate about licensing the reimbursement online. Our medical services online includes counseling, the revisits to the hospitals. In total, we have 25 disciplines and 145 doctors online to answer the questions. We have completed about 13,000 different cases and have prescribed drugs to 5,400 patients. So during the epidemic period, we have met the needs of the vast population, and we also try to reduce the pressure on the medical resources, particularly the resources dominated by those infected patients. So we have given advantages to the TCM and Western medicine simultaneously. We have improved our medical services and its service quality in order to contribute further to the health guarantee in the capital city. Thank you, Madam Wang Xiaoping. Now, we will open the floor to our reporters. Please identify yourself before you raise the question. In the eastern section and fourth row, please. From China News Service. My question is to Madam Jiang. You said something about the asymptomatic carriers. 26 are still remaining in Beijing, and they have unnoticeable symptoms. So, what are the risks faced by those asymptomatic carriers? Thank you for your question. This is a question concerned by most people. We can check the coronavirus and examine the result as positive in the throats or in the nose. So according to the guideline, it specifies that the infection source of coronavirus is mainly through the patients of the coronavirus turning to be positive and the asymptomatic carriers. So for the asymptomatic carriers, the transmission capacity is dependent upon their saliva and others. Although, compared to those positive patients, the infection level of asymptomatic carriers may be similar, but with no cough and other symptoms. They may give out less splash of saliva, so we encourage ventilation, social distancing, and washing hands frequently, and no gathering in public spaces. The general public cannot tell those asymptomatic carriers from the others, so they must strictly abide by the rules and requirements of epidemic control and prevention. This is the end of the press conference, and this press conference is being broadcasted lively by Beijing People's Government Information Office, Qianlong website, 首都之窗, Beijing Daily, Xinjing Newspaper, Beijing News Daily, Beijing Toutiao, Tingting FM, Beijing Time, Peoples.com, and People's Video News Agency Beijing Channel, CCTV Financial Channel, People's Daily Sinoblog, China.com, Beijing Transportation Radio, Beijing News Radio will also live broadcast this press conference. I would love to thank all the experts and our media friends for being present in the press conference. Thank you. This is the end of this show.